Hey, can you hear me?
Yeah.
Okay. So right now, you're set up as the host.
Yeah, I went ahead and worked for me, actually. I went to participant, and it said reclaim host, and then I had to put in that key that Ben sent me. So
Yeah, exactly.
So a lot of this is just, he gave me everything I needed, but he just didn't explain. And then, yeah, basically, and I completely understand he's a very busy guy, so I just a little bit more counseling. I kind of wish that, I want to thank you. I kind of wish that, I could have help for access to the panelists, but I think I got it. I think I can explain it without, not too badly. So I wanted to make sure that they knew everything that they can do during the patient, and to have them have a level of comfort with it as well. Because if you get confused and you press the wrong key or you do something the other, then it might end badly.
Yeah, and use that reclaim host role anytime, like if you accidentally hand it to somebody or somebody else has it and you want it back and they can't figure out how to give it back to you.
Mm-hmm.
And it'll just make you host again.
When I pass the ball, does it make somebody else the host, or does it make them the presenter?
It makes them presenter when you pass the ball.
Okay, yeah. I don't plan on giving the host to somebody else. Yeah, probably I won't need to. Yeah, but a lot of different possibilities passed through my mind. I was like, well, maybe I can go ahead and pass the presenter role to everybody, and they'll go ahead and go through the slides and click through it by themselves. But then at the same time, these are very busy people, and they're just kind of like send me the slides an hour ago. So for me, it's difficult to kind of want them to do that and not expect them to kind of mess up once or twice, and it just won't go well. So to a little bit more about it, I think I'll go ahead and handle that, and we'll do the Q&A I talked to you about doing it. Yeah, but do you have anything else that you want to tell me?
I think so. I'm going to be on the road, but I can be on a computer if you absolutely need me. I'm going to be driving. So I should be available. You know what? Just to be safe, I can give you my cell number. I think you really got to get a hold of me or something. It's 818 66 26.
Beautiful. Okay. And let you know how it goes, and I need you. Please pick up.
Yeah. No, I will.
Yeah. Then I think I'm in all right shape. I don't feel that bad. So.
Okay. And in regards to IM, if you send me something and I don't see it, send it again or try to alert me somehow. Because what happens is I'm at my desk and I have IM running there, and then I have my laptop that I walk around the building with IM also running there. It's also running on my phone. And sometimes I can be on one, but my message will go to my desktop or to my laptop, which I'm not on at the time, and I don't see it until I look at that one.
Okay.
If you went and logged on another machine while you left yours on and running, you would have two instant messengers running. And it should come on both, but it doesn't always do that. It'll just come on the last one you were on.
Okay. That makes sense, what you're telling me right now. Okay. And that I bet you that explains why Ben sometimes he doesn't respond back to me either. Yeah,
I know for a fact he has it on his laptop, his desktop, and his phone too.
Yeah, okay. Well, that's good to know, man. That's definitely Oh my God. Crazy.
Yeah.
You guys are just, all about technology. But
no, it's kind of just no problem.
and I'll go ahead and contact you if I need anything, okay?
Good, man.
All right, thank you. Bye.
Okay, bye.
Hey, Chad, how are you?
How you doing?
Very well. So we apparently have a little bit of an issue. We have some attendees who have logged in already 30 minutes or 20 minutes prior to the presentation. For those who are listening in and are attendees, can you please log out and plug in, 5 minutes till. We're going to be doing some test runs and some other stuff that doesn't really have anything to do with the content of the presentation. Hey, Chad?
Yeah.
It appears that you are the only one that made it as of now.
That's a problem, actually.
Yeah, I kind of figured that would happen, so we're just going to have to, I'll coordinate everything and we'll just run from there. But I don't want this, but if there's anybody attending, I think I'll have to expel you, and hopefully you can log back in if you're still logged in. Let me do something really quick. I'll show you how this program works, Chad. Okay, got it. This is uncomfortable. So how did it go? How did the, 'cause I know that there was a similar event going on at the Capitol today, correct?
Yeah, I was at I haven't heard back from Javier yet. I didn't go. I was at another meeting, actually, over in your building, upstairs at Mercury.
Okay.
Dealing with reach. It's around covered California. I guess they've taken a keen interest in it, or Ultimate has. So, see.
Yeah.
I guess the question is, we'll need that second round of funding.
Wow.
And how bad.
Okay, well, that's good to know. Anthony Wright sent me a message to join in as well. But in any case, you want to just go ahead and take a look at what you did? Okay, let's go ahead and share an application. Let me know if you see this on your screen. On your screen.
I see engaged.
See any also? Any other windows open?
I see a cursor moving around.
Just make sure that, if
a little different. Yeah, I see this opening.
Okay, so I'm going to be the one controlling this, but at the same time, you should know that one second. Do you see typing on Outlook?
Typing on Outlook.
Do you see that? Or do you not? You're not supposed to.
I'm typing. No, I just see the screen and cursor moving around.
Okay, good. Yeah, that's part of my concern, and that's part of the issue. We just started this contract with WebEx, and we are determining, how this is all going to work out and stuff. But this is a really useful program. And let's see. Here's yours. Do you see yours?
I see it.
Okay, so I'm going to go ahead and start the presentation this way. Do you see your cursor on top? Is there a cursor for you on top?
On my cursor now.
You can send messages. You could just to fellow participants. That's just something that I wanted you to know in case of the presentation. Do you know how to do that?
I just clicked the participants button.
You click that, and then
there we go.
You go to the send to, and then you either choose all panelists or just
a specific one.
Mm-hmm. Yeah.
Okay, I got that.
A second.
Then I can X out to.
After a bunch of folks are having problems logging in, all this stuff is happening. I'm so glad I started this earlier than anticipated. Yeah, okay. So yeah, so just know that you can send to different messages to folks. And I wanted to ask you, do you think it'd be best if we just kind of have, because there's 3 PowerPoints in the section related to the safety net. What if we have them back to back to back, and we have a big Q&A at the end? Do you think that would be best instead of individual Q&As for each PowerPoint presentation?
I don't have any objection to that. I mean, I'm last anyway, so. They're going to be asking questions after me anyway.
True. Oh, there's another PowerPoint. I'm not even kidding you. Okay. Wow.
Jeez.
That's 5 PowerPoints.
And the fact is, I almost didn't send you one.
Really?
Yeah.
No, good. I like yours. What, did you already have that one ready to go, or did you?
Yeah, that's from a different presentation that our ED did. She went down to Oaxaca. So a lot of that stuff was already in there.
Mm-hmm.
And it really just serves as a segue into the safety net point. You know, I didn't have to do a whole lot with it.
Yeah, it was good. It's definitely beneficial that you already did that.
That's why get down to our prior ED. I was invited to go down to Oaxaca and speak at a conference down there. So it just rained and poured the whole time. Yeah, she was going down this path and down to this little ravine, and it was a river.
Oh my God. Okay.
So what I'd like to be in Oaxaca, and then just have it dumping rain.
It happens. It definitely does happen. I'm still. So let me check what's going on now. Yeah, apologies about this. I thought some more folks were going to join in, and I was going to be able to go through a lot more. But in any case, what's important to know is that I mute and unmute folks, and if you're on the line, you can actually unmute or mute yourself on the right-hand side of where your name is. And you could also see next to the telephone icon, if it moves and it shows green, that somebody's talking. And you'll be in charge of most of these things just because I'm more familiar with the program now. So in any case, I don't think you guys have to worry about too much. I just wanted to make sure everybody had no issues logging in.
Okay. So are we going to be? You're going to be advancing the slides for us?
Yeah, I think that's how we're gonna have to do it at this point. If everybody logged in earlier, we could have. I could have shared presenter rights with some of you. And
Okay.
you
Yeah. That's no problem for me. I just want to know.
Yeah. I'm gonna stop sharing for now.
Can you hear? Hello?
Well, Ed can hear you.
Okay.
Hi.
How are you doing?
Good. Yourself?
Very well. I'm waiting for summer to officially start.
And being in Sacramento, I'm hoping it stays away a little longer.
I know. I know. You guys have it rough up there. But we've been having some good weather in LA where it's like 100 plus. And it's me. I'm like, what?
Yeah, today it's like 70. If it's 70, I'll be surprised. And it's windy. It's been really windy.
Oh. Windy in a way or windy in a bad way?
Windy in a bad way. You know, when you see small dogs blowing past your head, it's too windy.
Oh, sad for the dogs.
Well, he should be enjoying it. His tail was wagging, and so was his tongue. So
it's like a nice breeze, yeah.
Hello?
What are you doing up? Oh, hello. I'm up.
Great. Okay, so that is 2 down. We have 4 to go.
And you haven't from Angelica yet? Or have you?
Yes, she just emailed me.
Great. Okay.
Let me see. Angelica, did you just join? Angelica, can you
Right now. Can you?
Good.
Oh, I was getting a little nervous there.
We're having some technical difficulties. To be expected, this is a pretty huge.
I know. On?
Hi, I am. How are you?
I wonder if I'm doing fine. I saw PowerPoint, so I was literally going to do almost the same things. I just decided it's more about what could you do. So that's how I figured you could go first. And
okay, yeah. Like, if you want to, if you have similar presentation, I don't know how I can go after you.
No. I think you should. I think you would. What I did is I just kind of went through and more about now that this is the situation, what should we be doing right now in order to change it?
And I do had more about like the California impact too.
Mm-hmm.
A presentation with you finally.
Hey, I know we've done them a lot of times before, but I'm good. What did I do? Oh, okay. Never mind.
I just unmuted you. Can you talk to confirm?
I just was asked. I just wanted to say hi. I'm here now.
Really hear your voice.
Great. So
for you listening on the call, I went ahead and provided the contact information and just who's going to be presenting. Just in terms of the format, how many minutes each portion is going to be, and what the Q&A a lot of time is going to be as well. I'll talk more about that once we get started in a few minutes.
okay. And Josue, I sent you an email with a suggested order. Did you get that?
Yeah, I got your email with the PowerPoint.
But I also had a suggested order in terms of
Right, and I think the order that you said was Ron, you, Vanessa, and Chad. Correct?
Right. Vanessa's in the building right now, so obviously if she's not there, then just go to Chad.
Okay. Yeah, we'll go ahead and follow that and follow the slides as well.
Yeah, I think Ronald is broader and that sort of sets up what my longer presentation. But it's
sure. Just so you know, everybody can hear us right now.
sorry.
Yeah. Welcome, everyone. This is Josue from the California Endowment, and just to let you know that we'll get started in a few. Everyone, from the California Endowment, and I still see folks logging in quite frequently, so I think we're going to wait another minute or two before we formally get started. So I think the beeping has somewhat ceased or is less frequent, and my apologies about that beeping. That's actually people logging in to the presentation. Again, my name is Josue, and I'm with the California Endowment. Everyone, and I went and provided this first speech to kind of indicate to everybody how the presentation is going to proceed. I'm going to go ahead and provide an update on comprehensive immigration reform, as well as specific focus on health components of the bill. And then we'll open it up for Q&A for that section. And then we will proceed with the remaining initial proposal, spearheaded by Anthony Wright, Ronald Coleman, Ed Silva, and potentially Vanessa Kahina. I'll let my colleagues introduce themselves at this point. So if Sono, you can kick us off, please.
Hear me?
Yes.
You want me to introduce myself, or you want me to start? Sorry.
No, let's start with introductions, and
okay.
give folks a moment to write down everybody's contact information, and then we'll proceed.
Great. Well, thank you to the Endowment for putting this webinar together, inviting this great group of panelists. My name is Sonal Ambelkar. I'm the health policy attorney at the National Immigration Law Center. I work out of the LA office, our headquarters. And I concentrate on healthcare, and so I'm not an immigration attorney, but I'm happy to try to answer your immigration questions. And so I look forward to presenting.
Good evening, everybody. My name is Angelica Salas. I'm the director of the Coalition for Humane Immigrant Rights of Los Angeles, better known CHIRLA. And CHIRLA is an immigrant rights organization that is working on immigration reform, but also directly organizes immigrants and their families on various issues, including health care, and seeks to educate immigrants about access to health care and opportunities that they can have in order to ensure the well-being of their families. Pay special attention to exclusions of immigrants in these policies, and seek to also advocate so that they have access, like everybody else, to some of the most important health benefits available to them.
Anthony Wright. I'm the Executive Director of Health Access California, the statewide healthcare consumer advocacy coalition. Really about a proposal that we work with our organizations on to make sure that there is care and coverage for the remaining uninsured, part of the big fight we're in right now with regard to the Affordable Care implementation, Medi-Cal expansion, and the dollars for the county. I'll talk more about that in the second half of the state presentation.
Okay, Chad Silva, Policy Director for Latino Coalition for Healthy California, and I'll just be commenting mostly on how this is affecting the Latino population, but also with respect to a little more specifics on some of the effects on the safety net, particularly the clinics.
Ronald Coleman from the California Immigrant Policy Center. I'm going to focus on some facts on coverage for immigrants in California now, and talk about some coverage that's available under the ACA and why the remaining uninsured proposal is important.
So I think that's everybody that's on the line introduce themselves, and right before we proceed, I just want to do some my housekeeping things. Just for those who are attending, the format that we're going to follow, first we're going to follow comprehensive, we're going to go over comprehensive immigration reform with health updates from and Angelica Salas, and at any point during the presentation you have any questions, please utilize the Q&A box located in the toolbar, and please direct them to me. If you can, please state what organization you're with, and to the panelist your question is directed to. The presentation will be recorded, and I'll go ahead and send the recording of the presentation as well as any additional materials and potentially answers to any questions that don't get answered after the presentation is over. So with that, I think we'll go ahead and pass it to Sunil, and just, yeah, thank you.
Hi, everybody. Can you hear me okay, Jose? Okay, well, thank you. And I have a very short presentation because I want to make sure we have time for discussion. I'm going to sort of share in broad strokes what's in the immigration reform bill that's being discussed in the Senate, and sort of the overall provision, and focus specifically on what access to health care will look like for those who are on the road to citizenship. And then I will turn it over to Angelica for more of a bigger, broader perspective and what we should do next. So, currently the media and a lot of the attention has been focused on the Senate, in the U.S. Senate. The bill that everyone's looking at right now got introduced back in April, and it's the Gang of Eight, which is 4 Republicans and 4 Democrat senators worked together to create this bill, and it went through just recently the Senate Judiciary Committee for the last 3 weeks, and just passed actually last night out of committee, 13 to 5. It's on its way to the floor. And in order to make it out of the Senate, we're going to need a minimum of 60 votes. And Helika can give you more of the politics behind all of that. And in the House, there's been a lot of recent media attention that there's no official bill yet in the House. There's also a small gang of 8 a bipartisan gang working on the bill. And recent media reports in the last couple of days, it's sort of out there now that the access to health care that would be provided to immigrants under this bill in the House is now front and center of sort of the debate right now. And I think in the House there's a lot of concern for Tea Party folks that are in the House that they do not want a road to citizenship for immigrants because they consider that honesty, and the bill does provide actually a road to citizenship. So that probably is the better bill if we debate out of the House right now. Next. So there's lots of stuff in the 844 pages of the Senate bill, which is, I'm just going to refer to it as Senate Bill 744. I'm picking out just the very, very big pieces, and immigrant folks will have more of the details, and there's a lot of stuff on border enforcement and enforcement that I haven't included here, but I wanted to focus us on sort of how the bill provides civilization paths to folks on some of the other bigger pieces. So as I mentioned, the Senate bill does have a road to citizenship, which is an actual path that you can take to actually become a citizen rather than being given some sort of temporary status for many, many years with never an opportunity to become a card holder and a citizen. So there's this road. There's also, including that road, they created 4 new immigration statuses that are mentioned in the bill. The first one is the registered provisional immigrant status, and that is a status most people will be talking about from now on. It is the road for most of the undocumented immigrants as of right now that they would take. So the first step that they would take to become lawfully here is to apply for that status. Also a provision for agricultural workers, and they are given a different path, and it's the blue card, and I'm going to cover a few details in a minute. There's also a new family visa, which allows people whose family members are waiting in other countries and have already applied for a green card but are waiting years, that they are allowed to actually come to the United States on a V visa and wait for the application to be processed here, and it's a really good thing in terms of family reunification. And have another visa, the W non-immigrant visa, which is focusing on wage workers. There's been a lot of discussion about high-tech workers. I think there's agricultural workers, of course, and so this W visa is trying to sort of the non-skilled workers, but I will defer to Angelica on more information about that. Also, a mandatory E-Verify provision. Before E-Verify was sort of seen as, you couldn't get E-Verify. We didn't E-Verify unless there was an actual path to citizenship, and so because there is this legalization path, an assumption that now everybody will have every employer will have to have this E-Verify system to check work authorization, and it will be mandatory right now for all employers. There are no exceptions right now. And finally, I'll just skip through the end. There's different improvements in the immigration reform process. They're trying to address this long backlog. They're increasing the number of visas, but they did eliminate the ability to sponsor your siblings, and there is also elimination of what's known as a diversity visa program. There's a whole discussion about how we're going to people apply for legal status in the future, and whether it's a point system and how you're going to be evaluated to be considered eligible immigrant. Next slide. Quick sort of what the specific provisions are for the road to citizenship. There's obviously more detail than I'm putting on the slide, but just want to give you some broad strokes. So this is the main road that, again, most undocumented immigrants will have the opportunity to take. After the bill is passed, about 2 years, let's say, after the bill is passed, they will have an opportunity to apply for RPI status, and you have to pay a fine of $500 plus the application fees, which we don't know yet. You're in that status for 6 years, and you have to get that status renewed at year 6. And again, there's fines and fees, and there's other requirements. And then after 4 more years in that status, you can finally apply for a green card after 10 years. So you're in RPI status officially for 10 years. It'll probably be a little bit more than that, but the minimum of 10 years. And again, pay for fees and fees. And then you can adjust for citizenship after the years in a green card status. Again, paying fines and fees. So the box at the top, it says for a total of 13 years, take your citizenship from the date of application plus all the fees and fines. Next. There's been a lot of attention, of course, for the dreamers, the kids, the undocumented kids, and I know there's great support for it. So what they've decided to do in the Senate bill, at least, is to shorten their path to citizenship. So like all the other undocumented immigrants, they still have to apply first for RPI status. There's not a special status that they're going to apply for, so it's RPI. But at the end of 5 years, instead of waiting for 10 years, at the end of 5 years, they can get the green card and also their citizenship if they choose to apply away. They can remain in green card status, but they can apply for citizenship without waiting another 3 to 5 years. Slide. So the blue card visas, mentioned it's to be eligible, you have to have shown that you've been working here as an agricultural worker for so many hours and days, and then you're at blue card status for 5 years. You're going to have to pay fees to apply for this. Once you complete 5 years, you can apply for your green card, and just like it is under current law today, you have to wait another 5 years to be able to apply for citizenship. Next. So where does this leave us in terms of access to health care? So this is a slide just to remind folks what the status quo is right now, immigration reform. So under the Affordable Care Act, the way immigrants are basically covered is if you're lawfully present under CA's definition, and those who are documented. So if you're lawfully present, you are eligible for mainly the exchange and the tax credits, which APTC is the Advanced Premium Tax Credit, sorry for the acronyms. And CSR is cost sharing reduction. So you're, if you're lawfully present, you're eligible for that. And I have this wrong. So it actually, there is no 5-year waiting period in the exchange. It should say excludes 5-year bar. No 5-year waiting period. So the minute someone, for example, gets their green card today, they can immediately apply for premium tax credits, cost sharing reductions. So there's the 5 bar still applies, however, to Medicaid and CHIP, as you see, and still a narrower definition of who's lawfully who's eligible for Medicaid. So there are going to be in California many lawfully present immigrants who are not still eligible for federal Medicaid and are still subject to a 5-year bar. And so they're technically eligible for the exchange, but many of them we could cover under Medi-Cal program or state Medi-Cal program, and I know Ron's going to talk about that a little later. So as everybody has access to these coverage options, they're all subject to the individual mandate and can get exemptions just like everybody else. So it leaves out the undocumented. They have no access to the exchange, no access to the subsidies, and they're left with emergency Medicaid or restricted Medicaid here in California. They are exempt from the mandate and remain eligible for all of the community health centers and public health options. Next slide. Immigration reform, let's say the Senate bill actually becomes law the way it is written right now. The statuses on the right-hand side are the statuses I went over. So RPIs, Blue Card, and V visas, the way the bill is written right now, in any of those statuses before you become an LPR, you're basically excluded from everything. So you're excluded from Medicaid and CHIP, for sure. You're excluded from the ACA tax credits, both the premium tax credit and the cost sharing reductions. You are exempt from the individual mandate. At least that's the goal right now. And so basically you don't have access to any affordable care. You can buy insurance in the exchange now. Price. That's because technically now they're lawfully here, and so they're not considered documented, but are not lawfully present in terms of ACA's definition of exchange and for tax credit purposes. So it's almost like they never changed any access, basically. You have lawful status. They're still eligible for emergency Medicaid, and they're eligible for community health centers. The difference is they could buy full price insurance in the exchange, which we probably think is not going to be affordable to them, and so they remain pretty much uninsured. Next slide. Just wanted to flag, I won't spend time here, but there's a lot of still more potential. It could get worse. So if we think it's bad enough that everybody's been excluded from everything, it still could get worse. They could add further waiting periods. They could further restrictions to make it harder for people to remain on the path if they, for example, use health care in any way. So we are monitoring that very closely and making sure that those kind of restrictions don't get added, and that we educate folks that there are already enough exclusions and restrictions on folks that are on the road to citizenship, and that's already wrong. Slide. I'll just briefly mention, just to tee up for the other presenters, that there's a lot of work that can be done for if you're interested in actively, following immigration reform to date. There's a campaign called the Helping New Americans campaign, and we focus specifically on access to health care in immigration reform date. And there's a larger campaign that Angelica can talk about for just immigration reform updates and engagement. We are still trying to push for back the access to Affordable Care Act, like removing restrictions that are already there. It's going to be a heavy lift, but we are still pushing for that fair access. Basically, we want to make sure there's no further harm to immigrants, and whatever access they still have today, that they can at least maintain that. All right, I will stop here.
Then I will proceed. And following up, first I want to really thank Sonal for just a really condensed a lot of technical information very, very succinctly in this. So I want to follow up is with her presentation is to say that Healthy New California New Americans campaign is also part of many of the organizations working on that campaign are part of the Alliance for Citizenship and their campaigns at a national level fighting for just and humane immigration reform. And when we mean just and humane immigration reform, we're talking about really allowing immigrants to be full Americans in every single way, politically as well as access to the basic safety net and certainly access to health care. However, there's I'll give you a step a little bit back before I enter there. There's a lot we can do from California in order to influence the healthcare debate in immigration reform. And I really feel that it is important that we begin now, immediately, in order to have our voice heard from California on health care. Next slide. And so, as was described earlier by Sonal, for what's happening right now in immigration reform is we just passed the Judiciary Committee, a major step forward for immigration reform, in which the group of 8 that put together the bill held really tight in not allowing additional amendments on certain things that we wanted to fix on the issues of health care. Many senators did not take up this debate, or it took up the amendments to improve it. We improved it in other means, but certainly not on the health care component. And so we have another chance, and that is on the floor of the Senate, in which Senator Feinstein and Senator Boxer, pictured here, are incredibly important in order to ensure that, one, as Sonal described earlier, this bill doesn't get worse in terms of access to health care, and that amendments that will be submitted by other senators who are not part of the Judiciary Committee, that are not part of the group of 8, will now be moving forward. So immediately we need to engage Senator Feinstein, and now Senator Boxer becomes an important ally. Senator Boxer has always been a strong champion for access to health care and access for working people of all, on all issues, and is one of our, I would say, champion. So she becomes very important to safeguard immigration reform, to continue to make it progressive, but also to safeguard issues around health care access. Next. I want to talk a little bit more about the politics and what's happening in the House of Representatives, and why this conversation is actually so timely. This webinar is so timely. So as the negotiations move forward in the House of Representatives, there is a push by certain members, mostly of the Republican Party, and Sonal kept saying they. Well, they are members of the Republican Party who do not agree on having immigrants who will not be on this RP status have access to any benefits, who also believe that individuals on this path should not be charges, and has to demonstrate that they will never cost the government any money. So there's a whole focus on really making it very difficult for the undocumented to have access in the way that everybody else. And one significant point of debate, and also was alluded by Sonal, was that there are some members in the House of Representatives that want to push contingent on staying on this RPI status, as was described by Sonal, where you were on this path for 13 years, that you must be required to have health insurance during the entire 13 years. But as described earlier, many of immigrants will not be exempt, are exempt right now from the individual mandate, but this requirement would not make them exempt. In fact, they would be mandated to have health care insurance. The assumption is that they will have health care insurance through their employers. As we know very well, that's not necessarily the case, and they would be required to buy the product in the private market at the full price. And as we know very well, there's also a view of low income, who are low income, who many of them are working 1, 2 jobs and still living below poverty level. And as described earlier, there's no access to the ACA subsidies for low-income individuals, and there is a worse situation in the House of Representatives, that certain Tea Party representatives want to use the immigration reform debate to reopen the debate on the the Affordable Care Act in the same negative manner in which it was had when it was moving forward. And as you remember, this is the moment where the president's speaking to Congress, and he was challenged as to whether or not the undocumented were going to have access to health care, and it just kind of spiraled out of control in fully excluding undocumented immigrants from the Affordable Care Act, as was earlier described. So one of our fears is that the real goal is to attack the Affordable Care Act, and also by so doing, again, put more negativity towards the Affordable Care Act, but also stopping the momentum on comprehensive immigration reform. Next slide. What can we do right now? We can educate our California elected officials that are critical to this debate. So in the House of Representatives, there's also the Gang of Eight, the Group of Eight that is negotiating a House version. It's possible that this version that has just been approved in the Judiciary Committee can also be adopted by the House of Representatives, but also very probable that we'll have its own bill. So negotiating on our behalf in the House debate, we have Zoe Logfriend from San Jose and Javier Becerra. So these very important individuals to engage with in a conversation on immigration, on immigration and healthcare issues. Additionally, we have Nancy Pelosi and Kevin McCarthy, who are leaders in both of the in Democratic as well as the Republican Party, who are leaders who are going to complete oversight as to what the bill that moves forward looks like. So we're, in a sense, we're in California. We have the ability to influence these two very important individuals. And I would say Kevin McCarthy is important to move immigration reform in general, but Kevin McCarthy is also really important in order to make sure the situation around healthcare is really reined in, and most importantly, that we don't have those who hate the Affordable Care Act use immigration reform to further to do further damage to our community. Next. So what needs to happen? We also need to engage healthcare experts and advocates in the comprehensive immigration reform debate. As was stated earlier, the Healthy New Americans campaign is underway, but many of these decisions are being made without the expertise of healthcare experts, doctors, etc., individuals who really understand the situation of Californians, which we will learn more about. So we need to engage your voices in this debate in a very significant way, and to educate the aforementioned leaders around some of these components in terms of what does it really cost an undocumented immigrant who will then become who will then enter registered provisional status. How much is it going to cost that family, that individual and that family to pay for health insurance? And what is that impact on their wages, but also how realistically is this going to be? And it could mean that this is a way by which to just make the path to citizenship certainly not a mirage, but also by which to certainly make it impossible for people to meet those requirements. So we need you to monitor the debate. We need you to write op-eds about the importance of protecting everybody's health care, as you have done many times, and also to participate in comprehensive immigration reform activities and delegations in California and in D.C. to lift your voices on behalf of immigrants and their need for access to health care. Next. There are certain opportunities that are currently underway. We will have our members of Congress back in town May 27th through June 2nd. A very really important opportunity for individuals to stay in. We'll also be having sessions on throughout the month of June, and really just want to say to you that we invite you to stay connected to the Healthy New Americans campaign that was mentioned by Sonal, and also connected to activities that are happening on immigration reform through California Table. And for more information, you have my contact info, and I think we're now open for questions.
So, this is Josue Chavarin from the California Endowment. We really didn't receive too many questions from the Q&A chat box. Again, if you have questions, please direct them to me. through the Q&A chat box. I think we will go ahead and proceed to the next section, and we'll have a big Q&A once the presentation is over. Thanks.
Hi, Ronald Coleman from the California Immigrant Policy Center. I'm going to talk a little bit about ensuring access to care for all Californians. Next slide, please. California Immigrant Policy Center was founded in 1996. We're a nonpartisan, nonprofit statewide organization that seeks to inform public debate and policy decisions on issues affecting the state's immigrants and their families. CIPC engages in legislative advocacy and also provides technical assistance, training, and education on immigrant issues. Next slide, please. So here's just a roadmap of a little bit I'm going to present on today. So I'm going to offer some facts on coverage related to immigrants in California currently, and then also talk about coverage available for immigrants under the ACA. However, I'm not going to go into too much detail about that since Sonal covered that in her section. And then also talk about some of the Brown administration proposals that are related to immigrant health. Next, please. California's uninsured, ages 19 to 64, in 2009 was mostly citizens. As you can see in this chart, about 57% of those uninsured in California were citizens. Non-citizens made up 43%. Slide, please. I'll see by this slide, California's immigrants are disproportionately uninsured. So this chart shows 2009 data for coverage by citizenship for those ages 0 through 64. So as you can see, starting with citizens, it's about 17% of the individuals are uninsured. And then when you go to non-citizens with green card holders, essentially legal permanent residents, their rate of uninsurance is 37%. However, when you go to non-citizens without green cards, you see that the rate climbs much sharper to 55%. So as you can see, there is much need of more health coverage depending on your immigration status. Next slide, please. So immigrants are working, and as you know, oftentimes people get employment-based coverage. Unfortunately, though, working immigrants actually get less job-based health insurance or employment-based coverage in the market than other workers. And as you can see by this chart, this shows some of the sectors that immigrant workers work in. And immigrants actually represent 15.8% of the civilian employed population overall, but are overrepresented in high and low skill industries. So as you can see right here, if you look at those who work in private households or accommodations or warehousing, it is significantly immigrant populations, and these are definitely job sectors where it's less likely to have employment-based coverage. Next slide, please. Sonal did a great presentation on this minutes ago, but there are coverage options available to immigrants and their families. Of course, in the California Health Benefit Exchange, through the expansions of Medi-Cal and through other safety net programs. For the most part, as Sonal mentioned, presence is the definite in the ACA. So if you're considered to be lawfully present, you would be eligible for the California Health Benefit Exchange or Medi-Cal, unless we'll talk about some of the issues addressing some of the qualified immigrants that are subject to the 5-year bar. But for the part, if you're lawfully present, you would be able to have benefits from Medi-Cal as well. And also, there's many safety net programs available as well for the undocumented, whether it's public health programs that may be available regardless of status, if it's dealing with immunizations or some type of communicable disease, or it could be another type of state-only program that deals with a very specific illness, or, of course, we have the county 17,000 obligation, which is a requirement for the counties to provide care to those that are indigent and uninsured as well. Next slide, please. eligible, who's not. I'm not going to go through this in too much detail. Naturalized citizens, just like U.S. citizens, are able to benefit from the ACA lawfully present. There is no 5-year bar in the exchange, as Sonal mentioned. They are entitled to tax credits and subsidies, have the benefit of the Medi-Cal expansion as well. For undocumented immigrants, they're not eligible for the exchange even at full cost, but they are eligible for emergency Medi-Cal and the public health programs I mentioned earlier. Next slide, please. Is a proposal related to immigrant health that the governor is currently pushing right now. And state-funded Medi-Cal program. So both before and after the 1996 welfare law that passed in Congress that changed immigrant eligibility for lawfully present immigrants that were 5-year barred in federally means-tested programs, California continued to provide access to this population as solely a state function. So it's fully funded by general fund dollars. There is no federal match, and we do have qualified immigrants subject to the 5-year bar in this program. It's about 76,260, and there's also about 26,000 permanently residing under color of law, which are PRU calls. And, PRU call is not an immigration status. It's just a benefit eligibility category that simply means that the Department of Homeland Security knows that the individual is here, but doesn't have the intent to remove or deport. So, we definitely appreciate this benefit eligibility category here in California, especially in Medi-Cal, which provides full scope benefits to that population. So, proposed to have all recent lawfully present immigrants apply for coverage in the exchange. This was both in his January proposal and his May revised proposal. In January, we were a little concerned because this would have been the only population that would have gone to the exchange that would have been under 138% of the federal poverty level. Would have been very difficult for that population. You can imagine if somebody's making $600 a month, they're definitely going to have a lot of problems paying for cost sharing and premiums. So we're very concerned about what that may mean moving forward. However, in the May revised proposal, we did see that Governor Brown did acknowledge that there are certainly affordability concerns and benefit concerns. So he developed a mechanism for an affordability wrap and a benefits wrap moving forward for this population. However, CIPC supports putting all recent qualified immigrants subject to the 5-year bar into Medi-Cal, both those that are currently eligible for the program and also for those childless adults who would be newly eligible. But under the proposals that are moving forward right now, both ABX11 and SBX11, we're very pleased that those bills, being silent on the state-funded program, certainly maintain and preserve the program, but unfortunately don't expand to the childless adults. However, we're definitely working with leadership closely who, wishes they could, do some changes that could put this population in. However, there certainly are concerns about where the governor is or how the governor is framing this conversation around the fiscal note and the potential threat of a veto moving forward. Next, please. Just quickly, I just wanted to go through a few concerns about this position for this immigrant population. So, affordability wrap and benefits wrap, I think we're very concerned about how they may work operationally in the exchange. We certainly want to make sure that the person's plan is getting paid for and that at the time that they see their provider, they're actually able to access their health coverage and actually get met for whatever needs they're coming into the doctor for. As it relates to benefits, there's minimum essential benefits in the exchange. However, the childless adults are supposed to get benchmark benefits. We definitely want to make sure that this population who could potentially be pushed to apply into the exchange definitely has access to both of those types of benefits. And also in Medi-Cal, there's due process because it's a government benefit. And I think we want to make sure that we have these protections for this particular population as well. And I think for this issue, AB 617, there certainly is an issue related to there certainly is a bill moving forward by Assemblyman Nazarian that address some of the due process requirements in the exchange. And I shouldn't really call them that. It's more the exchange appeals process, but it is supposed to mirror the due process of Medi-Cal for this particular population. Second thing is we want to make sure we keep families together. There's likely to be children in Medi-Cal under this option. And, we certainly want people to be in the same network, be able to see the same provider, and also have the same benefits within the same family. So there are definitely next steps working with the Brown administration on next steps to address some of those concerns that I just mentioned, recent lawfully present immigrants. However, certainly need to be mindful of what could occur with some of the other state-only programs like breast and cervical cancer program, ADAP, the genetically handicapped program, AIM, Access for Infants and Mothers, Family. I think, in future we definitely need to be keep our eye on these programs to make sure that, those programs that are available irrespective of status continue to be available to Californians, especially in light of what we see with immigration reform moving forward and there being such long delays and restrictions for people that are going to be getting some type of legal status. The last thing I'd like to say is on the remaining uninsured piece is, as we really move this historic expansion of new coverage forward under the Affordable Care Act, we will significantly cut the number of uninsured Californians in half at least, and we may even actually reduce the number of uninsured people in California by 2/3. So it is estimated that 3 to 4 million Californians will remain uninsured, and approximately 1/3 of the remaining uninsured will be these new American immigrants who may soon be on a roadmap to citizenship under federal immigration reform. California certainly has a stake in the health and success of all its residents. And new Americans, they're going to be continuing to work. They're going to continue to pay taxes and be continuing to fully contribute to our economy in California. So it's really important for us to ensure that this population is healthy. Even with implementation of the Affordable Care Act, cost containment and elimination of health disparities in communities of color, and a true healthy California will only be a dream if our state's policymakers don't take actions now to ensure that everyone has access to health care regardless of immigration status. And maintaining the health safety net at the county level is an investment in the future for all Californians. Next. So contact information if you need to get in contact with us. I'm now going to turn it over to Anthony, who's going to dig into the remaining uninsured proposal and into much more detail. Thank you.
Part of this presentation. Access is really pleased to have been working with our partners on the issue of how to make sure that we provide care for all Californians, including immigrants and community color communities, but everybody, and really fulfill the promise of the Affordable Care Act. This is based on a concept paper that we released with some of our partners here today a couple of weeks ago. It's on our website at www.health-access.org. We on the front page is the joint statement by several organizations that has a one-page summary of the proposal that folks can use for their advocacy. There's also a 12-page concept paper that goes into more detail about this proposal. Next, you can follow us on Twitter at @HealthAccess, and I'm sure the California Endowment would love if you use the hashtag Health for All. So we're now in a moment of in the next 2 weeks, we will decide how we implement the Affordable Care Act. We will make a decision about how we implement the expansion of Medi-Cal, and the other final things we need to do so that California can be ready to maximize the benefit in 225 days when the extension will happen on January 1, 2014, and frankly in less than 5 months in October 2000 October here when open enrollment starts. The bill, there are some still differences between where the governor and the legislature is about making sure that people can most easily on Medi-Cal and stay on Medi-Cal as part of the expansion. But the biggest difference is that the governor has said he really wants to tie the Med expansion to taking some dollars from the pool of money that goes to fund the county safety net, the funds that go to fund public hospitals, clinics, county low-income health programs, safety net providers, public health services. And that is fundamentally the debate, and that's what we need your engagement on in the next week or in the next week or two. We need your engagement on this fundamental fight because we need to preserve the dollars for the remaining uninsured because we'll have significant numbers of remaining uninsured. Next slide. This is a slide from the University of California that talks about that shows it's documented are a portion of the remaining uninsured. If we do a great job with enrollment, I'll have 3 million remaining uninsured. If we don't do a good job, we might have a 4 million. But the point is that this is the that there will be undocumented, but there will be other categories as well. Next slide. That includes people who will be frozen between open enrollment periods in exchange-covered California. That includes other populations. So we need to have a strong safety net for it. I mean, don't get me wrong, there will be millions of people who will be covered under the Affordable Care Act, including the color, including immigrants. But we need to make sure that there's an option for those who are left uninsured for all Californians. Next slide. We, California, must lead on both sides, on both implementing the Affordable Care Act for the newly insured, but also making sure that there is safety net care and coverage for the remaining uninsured. Next slide. So what the debate is about. There's about $1.4 billion of money that goes from the state to the counties earmarked for health care. That's what's in debate right now. Counties have an obligation to provide some care to the quote unquote medically indigent. It's called the 17,000 obligation. But these vary wildly what they provide. Some run public hospital systems, have some clinics, pay private providers to do some care in more limited or expansive ways. Some are undocumented, others do not. Next. So we need to make sure that we need to preserve what we have and actually see if we can improve it because it is so unvariable and does create issues. There are counties that are so very wildly different. The governor's proposal explicitly says he's a formula that takes things from the county to recognize the fact that we're now covering some currently uninsured, that we're covering some of those folks. His philosophy is we need to take money to recognize that. He has some estimates in his May revise of the budget. He wants to take $300 million in the first year, $100 million in the second year, and $1.3 billion in the third year. That's more than 75% of the dollars that go to public of the state dollars that go to public hospitals, to community clinics, to safety net. That's what the government wants to do in his proposal. Obviously, we think this is too much too soon. That means that we need to have counties should take money for the first that they shouldn't take money for the first few years. The counties say at the peak demand when most people will be coming into the system, you don't want to beat money out at exactly the moment where there might be more need. The governor wants to tie this to a very complicated programmatic realignment of human services, which we don't think is viable or necessary at this moment. What it does do is it basically says that the counties get reimbursed for the cost they have now, but nothing more than the cost they have now. So it basically would lock in counties to the decisions they have made in previous years. Actually, would base it on the last 4 years, which was the greatest recession since the Great Depression. And so it's at a time when counties actually scaled back their health care services, when they closed clinics. They said, when a number of counties said, you know what, we're no longer able to cover the undocumented, like Contra Costa and Yolo and Sacramento County did. And what this would do is it would lock those counties and all counties into what they're doing today. It would take savings for the fact that there's some part of their population that would not be covered, but it would allow those counties to then redirect their efforts to other populations that are equally in need of coverage. So it's based on historical costs, not future needs. It does take into account health reform, change demographics, different health markets, etc. So next slide. So we have a different approach that is a vision of how we can actually do this successfully, which is we have the counties run right as a health reform to run these low-income health programs. These are learn to do the safety net in a better way, not just to provide emergency care or provide emergency or episodic care, but to provide primary and preventative care, to provide a real medical home for people so that it actually is a more efficient and effective way to get people care. We're doing that with 53 counties out of our 58 counties have been doing that and serving 600,000 people as a bridge for the folks who will then be switched into full Medi-Cal on January 1, 2014. So without legislative action, these low-income health programs, otherwise known as LIPs, would expire, go away at the end of the year. And our proposal is, let's keep these LIPs up and targeted toward the remaining uninsured. We need to build this infrastructure. We shouldn't let this infrastructure go away. We should build this infrastructure to meet this ongoing need that we have. And our proposal is then to tie the dollars that is in dispute to whether counties actually set up a LIP and based on their enrollment. So if they can show that there's an ongoing demand, and if they show that they can meet that demand, then they should be able to keep the money. So next slide. So our vision here is that we want to be the county's best ally in protecting the funds that go to the remaining uninsured. But also want to say it needs to be tied to actually providing a service to the remaining uninsured, including the undocumented. And so this slide goes into some of the more details about how we would structure it. I meant you go to the website to get our concept paper, etc. But I do want to get to the action items. So next slide of the work that we have yet to do. So we have great support from a number of organizations, including some on the call today. We got support from the editorial boards of the Sacramento Bee and the Los Angeles Times. Next slide. And a brief just came out yesterday that talked about how providing this kind of medical home model actually would really improve outcomes. Next slide. And we just fundamentally believe that this is a resolution to this issue of California is stronger when everybody has access to health care, and let's not lose this basic infrastructure. Next slide. We want to make sure that immigrants are included in safety net care and coverage, and this gives the counties the incentive to continue to provide that coverage. Let me go to the next slide because that's the action piece, which is we need your help on. We need your help. We don't have months on this proposal. We days, if not days. It will be decided in the next couple of days in June 15th, and so this issue will be decided literally in the next week, if not two. We need the communications with state counties, but ultimately this is up to the governor and the legislature and the key legislative leaders. Next slide. And so your help to communicate with legislators. There will be call-in days starting this Friday to call legislators to get and two big messages. One, protect the county safety net, the dollars for the county safety net, and two, the remaining provide care and coverage to the remaining uninsured, extend the low-income health programs, and that refer people to this proposal. We're trying to do delegation visits with key legislators. We want the legislators to impress upon their leaders that the remaining uninsured is a priority. Among key priorities in the budget, this has to be a priority. We ask people to do events around California's spotlight issue to legislators. We all need stories of people who would be impacted, of who benefit from these low-income health programs now, and who would in the future if we were able to maintain them. People who would not be qualified for the affordable care, the Medi-Cal or Covered California, but still need a place to go and to provide at least some basic necessary piece of care. Final slide. Again, here's our information. We very much appreciate your advocacy and activism and engagement, but this is something that's very exciting. We have the opportunity to fulfill the promise of the Affordable Care Act for all Californians, but we need your help to do it in the next in the next days and weeks to to get this done. Thank you very much. And so that, Jose, I know I'll pass it on to Chad Silva from the Latino Coalition for a Healthy California.
That's Anthony, and just one more slide that I kind of inserted. If any of you have any questions or want some updates, please email me at jchowardine@calendow.org. And I received several questions relating to whether or not this presentation will be provided for folks, and it will. I will send out an email with a recording of the presentation as well as PDFs of the PowerPoints. With that, we'll move on to Chad.
Again, this is Chad Silva, Policy Director for Latino Coalition for Healthy California, and I'm going to be focusing particularly on the Latino community because it represents the largest minority population in California, approximately 47-48% of the population of California. We're also a broad, sweeping population. Not only do we represent, middle-class folks, but we also represent low-income and undocumented population. So the safety net in many ways is very, very important to us as it is to other communities of color. And I think that I will couch these comments also with the proviso that I am also speaking of some of the issues that are going to be affecting other communities of color, such as African American, Asian Pacific Islanders, Native Americans. Next slide. And these are Latino-specific, again, of the 38 million foreign-born people in the U.S., California is the greatest number. So, again, California is a state of immigrants, a nation state of immigrants. It's estimated that nationally a majority of the undocs are of Latino ancestry. Nearly half the children in the state have at least one immigrant parent. Again, that raises an issue of mixed status. Again, might have varying degrees of citizenship. Some may be covered, some may not be covered. So, and that raises the question: well, do we really want folks not to be covered? Want to make sure that everybody has access, and it doesn't seem fair, especially when you raise the mixed status issue, that folks would have access and others not. Next slide. This again points to the fact that California, probably above most others, is an immigrant state. It is a destination, not just for folks from in our own country, from across the nation, for other states, but also from other countries. And it is quite a sizable chunk of folks that live here who are from abroad. Again, 37% immigrant. And 26 population later, 7%. This is old, so we are saying that a good chunk of those Latino immigrants are actually 48% earlier. I meant 38, almost 40% Latino. So we have the 26% immigrant of that population. We can move to the next slide. And we want to make sure that we're also pointing to the fact that a lot of the Latino population, it doesn't say it in the slide, over half of those between 0 and 17 today are Latino. In 2009, 2010, over half the children born in California were to Latinas. So we have a very young population. I think the median age of Latinos in California is 27 compared, I think, to 48 for all other populations. Compared to the white counterparts. Again, and then we have to look at, access. And it's estimated that 170,000 children will be barred from enrolling in Medi-Cal, purchasing private insurance in California and the exchange, again, due to their parents' immigration status. Next slide. And here are some of the, of course, some of the bars. California, 5.7 million Latinos will be newly eligible for purchase insurance in the exchange. Again, the prohibition against undocumented immigrants. An estimated 6.4 million Latinos in California will be newly eligible for coverage under Medi-Cal. Again, immigrants are unqualified for coverage due to their immigration status. And as we saw, that's going to remain the case no matter what happens with those other statuses. Next slide. we have these numbers. 30,000 undocumented immigrant children will be barred from participating in covered California. Approximately 150,000 uninsured children will be excluded from ACA-funded Medi-Cal expansion due to their status or their parents' immigration status. And these slides will be available, so I'm not going to spend so much time on them because I want to be able to have question and answers for the folks out there, so we can move to the next slide. Good graphic that shows, health insurance company, family, citizen status, and I think that Ron provided a similar one. It shows, what the percentage of coverages is for depending on immigration status, so this can be useful. Next slide. Another, again, I think Sonal really touched on this very, very well. This really just breaks it down. Undocumented immigrants, there's no federal coverage. 1996 made sure that as a matter of law, because we were placing restrictions on those who were lawfully present. So, of course, undocs are, by law just excluded. Not allowed to purchase insurance exchanges, not eligible for premium tax credits, exempt for individual mandate, not eligible for Medicare non-emergency. So basically all of and food stamps is included there, what we call federal means tested benefit. But they will, of course, remain eligible for emergency care. That is emergency room visits. Next slide. This we get to the point here. California's community clinics and public hospitals will continue to serve a significant number of uninsured. A lot of those, as we've seen, are going to be Latino. Not only be Latino, but they'll also be Asian Pacific Islander. They'll also be, other statuses and other ethnic groups, particular immigrant groups, that are going to have some trouble gaining access. Next slide. And currently, then, the government may rise, which is exactly what the and is referring to. Again, the proposal to pull $300 to $1.5 billion from county safety net funding. And another piece of that is moving all currently eligible but not enrolled legal permanent residents along with those who would be eligible under expansion to thus in the covered California. So no state-only Medi-Cal expansion, as was said earlier. And some issues with this. And I think this was also covered by Ronald. Covered California, one of the big ones is that Covered California does not have as robust a language access requirements as Medi-Cal. CPC has done a really good side-by-side comparison of the various language access provisions. In discussions coming from and talking with them, it's by no accident that they are not as robust under Covered California. As we've seen, with this being an immigrant-centric state, and with a lot of folks fitting into one or more family members fitting one or more of those immigration statuses, and AP population also being significant in California, language access is very, very important, particularly for this group that's going to be moving into the exchange. And we want to ensure, again, since we're now moving folks out of Medi-Cal, so and then we'll be augmenting the Medi-Cal, and that eventually folks will start moving out of Medi-Cal as they start hitting the 5-year bar, that the level of funding for clinics can be affected due to the rates they received for covering and providing care to Medi-Cal folks. So we're getting hit not only on clinics in particular are not only going to get hit on this county money that might get pulled out for those who have contracted and provide care at the county level and with the counties and for the counties, but also those who provide Medi-Cal coverage. And so I think I'm not going to belabor what you can do. I think that was covered quite well by Anthony and by Ron. I think it's important to get engaged. I think it's important to make sure that you let your local reps, your local senators know that it's very important to maintain funding for clinics, for the safety net in general, because it's not just the immigrant population, it's a low-income population as well, and it's those who will be turning in and out of coverage for various reasons. So not just talking about services for those who aren't currently covered under the ACA, we're talking about those who could be currently eligible, don't signed up for whatever reason, happen to slip through the crack. We're also talking about folks who are currently in good economic shape, but for one reason or another may slip and may not, may be in a position where they can no longer afford the insurance they have, and are in between coverage, and so need that safety net to fall back on. And that's why it is a safety net, because ultimately I think we need to remember that the safety net is for everyone. It's not just for those folks I've been talking about, but it's for you, it's for me, that but for the grace of God, we may not have to go, but may end up having to use at some point in our lives. So I think that I just want to emphasize that we need to make, we're engaging the governor's office. We need to make sure that we're writing letters. We need to make sure that we are writing op-eds. We need to make sure that we're getting in touch of elected officials and letting them know that the safety net isn't just about immigrants. It's very important to our population, but it's important for everyone because everyone find themselves needing those services. Thank you. Last slide. My contact information. That concludes my presentation.
Wonderful. Thank you for that. I'm going to go ahead and unmute all of the panelists now. And Donald sent me a message. She actually received some questions herself. I want to open up this up as an opportunity for her to go ahead and address those questions that were asked to her.
And I am going to call my fellow players to help with some of these questions. But I try to address the ones that you sent in were specific to the immigrant eligibility pieces. Maybe it's best to just repeat the question. So the question about what LPR stands for, and it's lawful resident, and I have more details in the Q&A box if you want to look. And I was going to skip to the question about from Ka that the question we've heard of undocumented residents who have TINs and have been told by their tax preparers that they'll be subject to penalty if uninsured after 2014. Is this accurate? So I want Jessica for this question. I think there's a lot of confusion, and I think one of the other really big action items that all of us can participate right now is community education and really explaining to immigrants the rules are under the ACA, because they are going to hear a lot of misinformation. So under the federal rules right now, the regulations that just came out, everybody is subject to the individual mandate, including dependents. And so you are only penalized if you are actually a tax filer and a taxpayer. However, if you are still subject to the mandate, you can request one of the exemptions based on affordability. And I mentioned not being unlawfully here. Unlimited is an exemption that you can let the IRS know is the reason why you don't have health insurance. So I think as Chad raised, the complication, especially for California, is a mixed status family. The parents may be exempt from the mandate, but if dependents are subject to the mandate and parents have to get insurance, then potentially it could be penalized if the child isn't insured. So there's also another critical reason why we need to get all mixed status families enrolled in the programs that they're eligible for. But so I guess I'm saying they're subject to the penalty, but they can get an exemption, especially if it's unaffordable to them. They can also get an exemption for that. that question?
Yeah,
I think you did it well.
And how are you going to say something?
No, I was just going to say in terms of having an ITIN too. I mean, that's you do not have a Social Security number by which to file your taxes, so automatically that would disqualify. That person would be exempt. Obviously, I think this question brings up the education of tax preparers and others who are engaging with our community, and so we have to do the kind of education for folks to be able to fend off some of those misconceptions, and so I just think that certainly it really I would say helps us to be prepared prior to April 15th when everybody's filing taxes to make sure that they have the correct information. So thank you for that question.
So I'll take one and then I'll turn it over to one of the other panelists for some of the other questions. So the next question I'd like to ask is a question from Jacqueline. What benefits will naturalization or undocumented immigrants bring as far as access to health care for everyone is concerned? So, right, that everyone's affected by this, that immigrants are excluded. So I think your question is basically asking when someone gets their citizenship, benefits to health care they'll have. As I think I went over my presentation, even under immigration reform, while they're on that path to citizenship, unfortunately being excluded when we thought that just, fix it during immigration reform, the fact that they got excluded. But now having to wait at least 13 years before they can actually get access. Once you're a naturalized citizen, you have all the same benefits and privileges to benefits that U.S.-born citizens do. So that is also one of the goals, is make sure immigrants have that pathway so they can fully participate. But in time, we also want them to fully participate in access. So let me turn over to maybe Anthony. Do you want to try to?
Yeah, I think obviously our preference in any situation is for people to get covered, for people to get, for people to have coverage in the exchange subsidized, so they don't have to pay more than a certain percentage of their income, or to get Medi-Cal coverage, and again, and obviously getting folks on the path to citizenship. Citizenship help in that regard, and as Ronald pointed out, there is actually a pretty good correlation between your immigration status and being covered, and so there's that by itself is a big way of getting people access to health care, is if they're in more legal, more naturalized, more citizenship statuses, not only gives them more access to pub programs, but it also means that they're more likely to have the market power in the job market to get private coverage, employer-based coverage. That said, we want to make sure that there is something. We want to make sure that there is a safety net for those who are not covered, and that's what the proposal I outlined and talked about, is that if you do not qualify for the exchange, if you do not qualify for or state programs, that there be something left at the county level, and the counties have sufficient funding to put that service. At this, governor is very clear that he doesn't want to pay for the same person twice, and we think that this is a mechanism that abides by that, because to the extent that if immigration reform did get lots of folks covered either now or in 10, 15 years, then as the number of uninsured goes down, then the state can claim more savings appropriately. But we don't want to take that money prematurely when still is a large number of remaining uninsured. And frankly, some of this we may not know for weeks or months or even for 10 years, depending on some of the terms in the immigration laws as well.
One more thing, which is that in California we have earlier was 10 million immigrants in California who are Latino. I want to just explain that we talked a lot about the undocumented today. We have many individuals in California who are legal permanent residents, and that means that they live in this in the state. They pay taxes like everybody else. They have the full right to work and travel in the state and in this country. However, they're not yet citizens. And so it's over 3 million individuals in that situation, and our state has not invested in really having outreach and naturalization programs like other states, but move individuals from LPR status to fully naturalized citizens protects them the most in terms of access to safety net programs, access to health care programs. And so while we talked a lot today about the undocumented, don't want to forget the legal permanent residents who are now eligible to become citizens and who are not. So there's incredible programs across the state to try to do the kind of outreach, do the application assistance for naturalization. But I really just want to highlight the connection between the position of citizenship and access to health care.
I guess going off of those statements and kind of addressing two questions asked specifically by Michael Cox and Scott Graves, can you expand a little bit more, Anthony Wright, on how the LIP proposal would extend coverage to undocumented folks at the county level? A requirement, or it looks like?
So, again, right now, counties have a very vague obligation to the uninsured, and some counties take that to mean the undocumented, some do not. So, LA and San Francisco and Alameda, and even in a place like Fresno, it does. But in Orange County, it doesn't. Recently, counties like Sacramento and Yolo and Contra Costa, which had been doing it over the course of last many years, had scaled back coverage. And so the idea is and there's no specific requirement now of providing that. So the question is, in your world, should those counties be locked into what they're doing now, where they were? You think that was good policy or not? Some of those counties were deciding that with a very limited set of funds, or the funds that they believe they had, that were directing one population. To the extent that population is being covered, should automatically take that money for savings, or should the county be allowed to redirect that money to the insured that remained, including the undocumented? We said if the county are given the opportunity to continue to use those dollars, many of those counties would take that. But if that money just gets taken away, then we have no ability to. Then it's a much harder case to make at the county board of supervisors. So what our proposal does is incentivize counties to as many is to provide to get as many people enrolled as possible. Everybody who presents themselves in an emergency room or county system would be first enrolled for Medi-Cal or Covered California or whatever was eligible to them. But two, would incentivize them to sign up people, including those people who are not eligible for ACA type coverage, because then they get a match. They would get a reimbursement for those services, and it would incentivize those counties to try to provide not episodic and emergency room care, but primary and preventative care, to really be more efficient with those dollars to provide a care that is more effective in one end, not just in the back end. So that is our proposal. It's not a mandate on counties that they all have to cover undocumented. I think it's too. That's maybe a fight for another day. But right now we can't even have that. We can't even have that discussion if the money is taken away. So again, the two big talking points are: A, protect the county safety net, protect the funding for the county safety net, including public hospitals, clinics, any low-income health programs, and B, extend low-income health programs to and have a formula that recognizes the needs of the remaining uninsured.
Great. Thank you for that, Anthony. And just really quickly before Ronald Coleman has to jump off the call, there are two questions that are specifically directed to him by Laura Morales in Santa Cruz County, and she's asking you if AIM will continue in 2014, if you know anything about the status of reproductive coverage through Title 10.
I didn't. Did you? Is AIM going to continue after 2014?
Yes.
Yeah. So access for infants and mothers actually wasn't one of the proposals that the governor decided to shift those eligible into the exchange that are currently eligible but not enrolled by January 1st, 2014. I believe it was only the genetically handicapped program, AAP, the AIDS drug program, and also the breast and cervical treatment program, and also the state-funded program, or state-funded Medi-Cal for qualified immigrants subject to the 5-year bar. We do expect AIM to continue after 2014 along with all of the other programs that Governor Brown does have a proposal on related to the exchange. He did recognize that the undocumented and PRU-Call are not eligible for the exchange, and he has kept those populations in those programs for that reason. And could you repeat the second question, Josue?
The second question was about the status of reproductive coverage through Title 10.
I have an answer to that question. I'm hoping Sonal or Anthony right now.
Sonal. Yeah, Sonal can take care of that.
I'll just jump in really quick. I think that this is a really good place to also remind folks. So Title 10 for family planning, and fortunately they are available to services are available to undocumented immigrants, but what technically the federal government does is take a percentage off of what California gets based on our estimates of undocumented immigrants. So all of that, unfortunately, for both the attack on contraception and for abortion, is now getting intermingled with the immigrants, and so funds like Title 10 are being spent consistently for both reasons. So definitely pay attention to the congressional attempt to cut that program or to reduce it. But right now there are no immediate threats to Title
10. Does anybody else on the panel have anything else to add to this presentation before we wrap up?
Just again, I want to impress upon people in our last minute or two that that the time for advocacy is now. Please, we need lots of communication with the legislative leaders on the issue of the uninsured. They will make a decision about the county dollars. There's lots of priorities that need to be that we need to preserve the dollars for the county safety net and make ensure a formula recognizes the remaining uninsured. Prefer we can do that by extending a LIP. And if folks have contact Health Access to do so, we need and your advocacy in these next couple of days moving forward.
Likewise, on the federal level on immigration reform,
absolutely,
that we need to make sure that we have your voice, your expertise in this debate, so that we don't make our whole goal is to make access possible, not to further curtail the access to the uninsured.
With that, I want to thank everybody for participating, and if you have any more questions, please don't hesitate to email me at jjardine@org. I will send subsequent materials.